again, thank you all for coming, and I know that your glasses are rapidly emptying, so I will be brief. Actually, my first degree was in education, so I would feel naked if I didn't have audio-visual, so here they are. Okay? But I think this is a really neat opportunity for myself to explain to you all, both as a previous educator and as an optometrist, why this is so important. And I'm going to even take it up a notch and say why it's more than just classes. Okay? So you'll all have some takeaways with this print information because we feel it's so important. But I just wanted you to know that experts estimate about 80% of what a child learns during the school day under normal circumstances is processed through the visual system. Okay? Yet, when children enter school in the state of Ohio, only 1 out of 7 of them has had an eye examination. That's the whole state. Now, if we were across the river, every one of them would have, because Kentucky is one of the few states in the country that has a mandatory eye exam law prior to entering school. In Ohio, we have something a little different that I'll talk to you about today. Now, it gets even a little scarier in that upon graduation, only half of Ohio school children have had an eye examination. Half, okay? So the numbers, and that's the whole state. Now what happens when you talk about children that are at risk? Children in situations where there's a single parent, working parent, a Medicaid child with limited access. And what we want to make sure you all understand is just because someone's insured does not mean they have access. If a child has Medicaid, there's a problem in getting that child into a doctor simply because there's a lack of providers, and the eye doctors and other doctors in the room know why, because Medicaid reimbursement is abysmal. And it's next to impossible to run a practice entirely on Medicaid reimbursement. So there's a lack of providers, a lack of hours that comply with a single parent. There's homelessness issues, there's literacy issues, there's a lack of understanding, and quite frankly, a lack of importance that's attached to it. So that's what school-based health centers really address, right? So we're delivering health care where the children are in the school. And at Oyler, 93% of the children, 90 to 93, have insurance. They're insured through Medicaid. And that's important because school-based health centers, what the health department has done is made us an FQHC lookalike. And rather than bore you with government mumbo-jumbo, that means we get reimbursed extra as an FQHC lookalike. So if I'm a private practitioner and I bill a Medicaid eye exam, I get a pittance. But in this scenario, I'm going to get paid almost 3 times as much because the feds have realized this is an at-risk population, and that's the carrot that they give the providers. So when you hear Marilyn talking about sustainable, absolutely. So this isn't based off volunteers. This isn't based off goodwill. This is a billable, functioning model that we're developing, and that's why it's so important. We also, in the state of Ohio, have, oh, my son let go of a balloon. Good catch, Todd. We also have in the state of Ohio, we don't have a mandatory eye exam law, but we have an IEP eye exam law. And the educators in the room know what that is. An IEP is an individualized education plan. So an IEP, if a child is referred for special services of any kind, in the code of the state of Ohio, we have triggered an eye examination by an optometrist and ophthalmologist within 90 days. This facility is going to help CPS become compliant with the law, which I think is a pretty good thing. So what our facility is going to do, we're going to get the children of Oyler an eye exam. Okay? Thank you to Craig Hockenberry as our host. The children of Oyler will receive an eye exam, and that's important. Because when Craig, and if you know Craig, he's this big cheerleader kind of guy, and he's all excited, he was rolling out blueprints. And this space here was originally designed as a media center, okay? And those of us on the project team, we thought they wanted to put us in these little rooms, and it was going to be all disjointed, and we were just like, oh, this isn't going to work. We want this space. But Craig was like, no, that's the media center. That's where these books are going, and all this great stuff. Well, they found out that they weren't going to get the grant to pay for the things in the media center. And so we were sitting there like sharks, circling, okay, we wanted this space. And when Craig finally slumped over and said, yes, you can have that space, I felt really awful, quite frankly. And I mumbled to Amy Scribner in the back. I said, oh, I just feel terrible about this. These kids aren't going to have books. And Amy said, but Terry, now these kids are going to be able to read books. Yeah, we'll bring the team up. One last thing, and this is why I say I'm taking it beyond eyeglasses. This is, as I chair the Children's Visions Task Force for the state of Ohio on the Ohio Optometric Association, and the public thinks of glasses, glasses, glasses. Okay, so when you go to the pediatrician or you go to the family physician, I'm married to one, they're good people. When you go to these guys, they have you read the eye chart, right? What's school? School's right here, right? The reading and learning. Do we check that? Do we check that adequately? I think the doctors in the room would argue that we don't. So even the screen fails, even if we capture them, which we know in high-risk populations, the referral rate can be as low as 2% that actually complete that cycle. But even if we capture them, what about the kids that can't read? And then those kids that it doesn't feel good. And if you're over 40, you know it doesn't feel good when you try to read. And if you tried, and if you were a child like that, what are you going to do? You're going to close the book. You're going to wander off into space. And you're not going to pay attention. And your teacher is going to think, boy, this kid is slow. This kid can't learn. This kid can't read. It's not the kid can't read. He can't read clearly and comfortably. And that's what this comprehensive eye exam is going to do. Okay, so we're really excited about this. I want to take a quick moment, and I know I'm over my 3 minutes. I want to bring up the project team. And we've got Don and Todd and Joan from the Cincinnati Eye Institute Foundation. They didn't think they were going to have to talk, so they were drinking. And then I've got the one-site people. This is one site, not one drink. So Angie Hartman, Carrie Van Pelt, and Dr. Jason Singh are here. Carol Weinel from the Children's Hospital Ophthalmology Clinic. Joan Austin-Worth from the Eye Institute Foundation. These guys, and this lady, Barb Brown. You know, oh, and actually the most important of all, the birthday girl. Lauren Taman Raines is here. It's her birthday, and if we could all say happy birthday to Lauren, that would be great. And last but not least, one of our founding members that has left the project, left the Institute Foundation for a new project with Easter seals. She thought she was out of it. She's now just volunteering for the project, Miss Amy Scribner. So thank you. I'd just like to bring up Tanya for one final comment. You all can go back to what you're doing. Tanya's around here. Tanya work, Craig. Tanya work.
I'll never forget it now. All right, so and just a note on Terry. She's my neighbor. Never have I ever had finer neighbors than the Dotsers. And if you see that passion, I've been listening to that passion for a year. Tanya, we're going to do this event, and you're going to have to do this event for me. Okay, I'll do the event. So that's what you have on your team. You are very, very lucky. And let me tell you, we have an opportunity for all of you.